Well, even young and healthy people are at risk for COVID-19. I recommend that you get vaccinated.
I don't want to put that virus in my body. My immune system is strong.
Well, mRNA or messenger RNA vaccines don't put the virus in your body. It doesn't matter that you have a strong immune system. If you get COVID, you could still get seriously sick or die.
I don't think it's as bad as the media says. My brother got COVID and it was just a bad cold. But some people get the vaccine and get strokes. I'm fine without it.
He definitely seemed like, okay, get it or not. He said the words, but there was no feeling behind him. Like, let's get this over. We don't want to do that. Okay. And so
Yeah.
it just wasn't a good interaction. And I definitely don't think it would have changed anybody's mind. I probably wouldn't do it just because he had.
One thing I've been checking in with everybody about, especially people who work in jobs where they're interacting with a lot of people right now, is just seeing if they've been able to get their COVID vaccine. Is that something you've thought about or have already done?
Nah, I mean, I'm not over 65. I don't have, high blood pressure. I'm okay.
Yeah, sure. That's great. And you're right that people who are older and have other health conditions definitely are at higher risk for getting really sick with COVID. But I actually worry about everybody right now. Can I ask kind of why you haven't gotten it or what you've been thinking about?
I was interested to keep having it. I had more questions and I felt like I was hearing some different things from her than I had heard from some of the people in my community.